Hello and a very good evening, all of you. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be doing really good. Today, we are talking about the essential role of moisturizers in managing dry skin disorders like eczema, psoriasis, or simple dryness. If you're struggling with dry skin, you're not alone because moisturizers are key to keeping your skin healthy and comfortable. Dry skin happens when your skin loses moisture and can't retain enough water. This leads to rough, flaky, and sometimes even itchy skin. Conditions like eczema or psoriasis make this even worse by damaging the skin's natural barrier. Now, we are going to have an important chat about them and how we can stop them from spreading by taking action early. So don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. So we'll look at how to manage dry skin from happening and talk about the latest things that we can do. So let's connect today with our skin expert, Dr. Aruna Devi, who is MD, Derma, trained in aesthetic dermatology and dermatosurgery, diploma in cosmetic, gynecology, non-surgical, ICCG. She is also the member of IADVL, ACSI, CDSI, IMS. Also, Dr. Aruna Devi is a trainer in Allergan Medical Institute, AMI. Throughout her career, she has contributed significantly to the field of dermatology. Her commitment to advancing the understanding and treatment of various skin conditions is evident in her extensive body of work. Uh, she is joining from Guwahati, and today the topic is moisturizer's role in dry skin disorder. A very warm welcome to you, Dr. Aruna Devi.
Hello, very good evening.
So, doctor, today we are going to talk about the role of moisturizer, and because it's winter, most of us are experiencing winter in our localities, and we know how bad it is for our skin because it makes it so dry. Even in summers, because of these air conditions, etc., skin mostly is in that dry zone these days. So, first of all, because we are going to talk about the role of moisturizer, but what are the common causes of dry skin, doctor?
That's a very important and very good question, because as you have already mentioned, now the winter is approaching, it's harsh, and this kind of weather, skin becomes dry. So this is first and foremost, causes of dry skin. Apart from this, well, aging is a commonest cause. Apart from the sun damage, that is another common cause of skin dryness, and then say cold and this dry, windy weather, then the say excessive use of uh, hot water for bathing, then excessive use of hand wash and your detergents, soaps, everything, overbathing, then use of very hot water and not using regular moisturizers. These are the common causes. But apart from that, there are some specific skin causes as well for causing these dry skin disorders, like some genetic conditions like ichthyosis, psoriasis, atopic dermatitis, allergic dermatitis, rosacea, acne. Those are some conditions where we got the excessive dry skin. In some causes like oily skin as well, but in most of these cases, we get specifically dry skin. So, xerosis and these kind of things are dry eczema. These are the commonest causes of dry skin disorders.
Okay, doctor.
And it
Doctor,
involves not on a particular age group. It starts from early childhood, middle age, young age, to the geriatric age group as well.
okay, fair enough. Now, doctor, because we are talking about these dry skins and the, skin disorders associated with dry skins, as you mentioned, acne, atopic dermatitis, psoriasis, etc., etc. We all know that moisturization or keeping your skin hydrated is important. But then many a times we just focus on our face, not the whole of the body, or not in our hands or legs, etc., which is mostly exposed. Now, what is the right way of moisturizing or hydrating our skin, especially for those, because there are many who feel that there is no need of, putting moisturizer on your rest of the body skin, especially those who have a oily skin. They feel that they are blessed, they don't need any moisturizers. So, what is the best way of applying moisturizer? What all we need to take under consideration while hydrating our skin?
Yes, it's very important, like moisturizers all throughout the year and for every age group, it's a very important ingredient for our normal routine day-to-day skincare regime. But the thing is that it's very tricky, very important to choose the right kind of moisturizer for your specific type of skin. Say if you have a very dry skin, you will have to use moisturizers that is quite hydrating. It should retain the water component. It should retain the moisture intact. So we'll have to choose that kind of moisturizer which is having those qualities, those ingredients that can retain the moisture intact, and it can protect the skin barrier so that our the barrier function, skin barrier function, what we call transepidermal water loss, that should be prevented. So we have to use those kind of moisturizers in case of dry skin for your face, for your body as well. So you have to choose accordingly. If you have oily skin, then again you will have to choose that kind of moisturizer which doesn't block the pores, and it retains the moisture, and yet it doesn't keep the skin very oily. You feel very lightweight. So those kind of things. And if you have sensitive skin, accordingly you will have to choose your moisturizer. But when you apply moisturizer, you have to be very liberal about using it, and you have to use it very, there are, like you can use the moisturizers as a need-based thing, as a regularized, say twice or thrice daily, or say whenever you wash your hands or wash your face, you need to apply a moisturizer according to your skin type. Hello, your voice is not audible.
Yes, doctor, I'm saying that do moisturizers have any role in management of, say, acne, atopic dermatitis, psoriasis, eczema, etc., etc.?
Yes, very much. Because we usually think acne prone skins are oily. Okay, they are not dry, but that may not be true always. Because in acne prone skin, also patient may feel dryness, patient may feel combination skin. So you have to choose your moisturizers accordingly. So if you use a very drying type of moisturizer, that will eventually leave your skin very dry. It will be very uncomfortable, irritation, a kind of thing. And when this dryness, the exfoliated cells and debris and those oil secretions, they eventually clog the pores, and the acne may be aggravated rather. So you have to choose a very lightweight moisturizer which is not very, say, oily or not very dry, which is suitable for your skin. And this dryness again, it causes the irritation, and it exfoliates the superficial skin barrier. That's why what happens when this in oily, in acne prone skin, when this oil secreting glands, the sebaceous glands become very much activated, and they produce more and more sebum, and they attract the bacteria, those Cutibacterium acnes, no. So those bacteria, they can flare up in the dead exfoliating skins. So this is very common for acne. Again, for atopic dermatitis, it is a dry skin disorder. Okay. Though the atopic skin is, again, it's a dry, irritated, inflamed skin. Okay. So it's very common in atopic skin is a dry skin, and it causes the irritation, it causes the itching. Okay, and this leads to so many other symptoms of atopic dermatitis. So these are very common in acne, in psoriasis. Again, it's a chronic inflammatory disorder. The skin becomes very, dry and, inflamed. So this dryness is the main component of these disorders.
Right. So in case you want yourself to have a healthy skin, please moisturize it well, moisturize it adequately. Now, when we talk about moisturizer, because in our society, we are so obsessed with, applying oil on our skin, or we make, various kinds of concoctions, especially for winters, etc., using a number of things, and we feel that they are good for our skin. What's your take on that, doctor? Do oiling, moisturizing, they are the same, or we need particular moisturizer?
Yeah, particular moisturizer, that is very important because as I have already told and we have discussed about it, because you have to take a good quality moisturizer, no doubt, but it should be suitable for your skin type. You cannot use any ABC moisturizer for your skin type. Every individual skin type differs from each other. So accordingly, you have to choose. The moisturizers, they should perform three things. One is the emollient. They should, keep the skin soft. Okay.
Right.
And second is the humectant. That is, the thing is that the moisturizer should retain the water portion, the hydration. Skin should be kept hydrated. Third is occlusion. Occlusion means it should retain the water content and it should be, protected. So these three things should be there in a ideal moisturizer. So for that thing, the vehicle, the component of the moisturizer is very important for our skin type. Say in dry skin, say if you have lots of hyaluronic acid, lots of glycerin, lots of ceramides, lots of squalene, those things, vitamin E, those are very important ingredients for moisturizer for dry skin. Okay. And as well for say other type of skin, for say oily skin, you should have like the vehicle and the components should also contain some more of vitamin E, squalane, and natural moisturizing factors, then the glycolic acid, retinol, everything, so that the oily skin gets the enough ingredients, and as well for dry skin you get the enough ingredients to protect your skin.
Okay, fair enough. And what is the right way of applying moisturizer? Many of us, apply it immediately after we, bathe or take a shower. Or so, what is the right way so that, it can really give us good moisturization for a longer time?
Yeah, that is important. Actually, the timing of applying the moisturizer, whenever you take a bath or you take a shower or you wash your face, immediately within 3 to 5 minutes, you should apply the moisturizer liberally so that it will get absorbed and the skin gets enough of moisturizer, enough of hydration, and it will remain intact in your skin, and the transepidermal water barrier should remain intact. So as early as possible, after shower, after washing, say within 3 to 5 minutes is the ideal thing.
Okay, so within 3 to 5 minutes, we need to apply moisturizer. There are other things, doctor, like, taking very hot water, using very hot water to bathe or to, shower, etc. And many times we feel, especially during winters, we do that and we feel that our skin is, becoming more harsh, more dry. So is there a correlationship?
Yes, definitely, because at the very first, when we discussed about the causes of dry skin, this is one component where the skin becomes irritated when you take a very hot shower bath, or if you take very hot water for washing your hands or washing your face, skin becomes very dry because the very hot thing, it will exfoliate the superficial moisture, it will peel off and the skin becomes irritated. Very cold and very hot, both things are actually harmful for our skin, so you have to go in between to
Okay.
protect it.
And doctor, when we are talking about these, dryness related disorders of skin, how frequently should moisturizers be used specifically in these conditions?
Yeah. For normal skin to say twice a day is okay, sufficient, or thrice a day. But for this dry skin disorders, when you have atopic dermatitis, when you have psoriasis, when you have dry eczema, or when you have rosacea, or these kind of things, ichthyosis, you have to moisturize your skin very frequently, maybe every 2 hours, because these are the conditions where we have lack of those moisturizers, lack of hydration, skin hydration, lack of skin protective barrier. So you have to protect your skin very frequently. You should not let it become dry. Okay, when you are at home, make it comfortable and apply it, say twice, means 2 hour interval or 3 hours interval. And it's a need based thing. When you feel your skin becomes a little dry, you can apply it. There is no specific hard and fast rule. You should apply this much time, not this much time. It's nothing like that. It's a need based thing.
Right.
Okay.
Yeah, because mostly, it's our hands. We keep on washing or, issue of tissue usage, etc. is more with our hands, but we forget to moisturize it that
And
often.
it also depends on the quality of water you are using. If it's very
Okay.
hard water, quality of water also, causes some
Right.
effect.
Okay. There are so many questions by our viewers. I'll try to take them one by one. So there is Abhinav, and his question is, do moisturizers with vitamin E help heal dry skin faster?
Yes, not only vitamin E, but so many other like ingredients should be there for a moisturizer to become ideal. Okay. Yes, of course, when you have dry skin, vitamin E ingredient, one of the component of moisturizer, it will definitely help, but not alone it can help. Along with the ceramides, along with the hyaluronic acid, along with the moisturizing factors, along with glycerin, then only it will help. Okay, it's a mixture kind of thing.
Right, right. Muhammad Talib Khan is here, and his question is, which kind of or formulation of moisturizer is best for acne-prone skin, cream-based or gel-based?
It should be gel based basically, but if you have a very dry, or you have a combination kind of skin, then nowadays we have some gel cream kind of things. Okay, it's not very gel, not very creamish, so in between. So you'll have to choose accordingly, according to your skin type. If your acne prone skin is very dry type, you can go for a gel cream base, and vehicle should be, butter components should be much more. And if you have oily skin with acne proneness, then you will have to go for a pure gel base, okay, or serum base. Otherwise, if in a dry skin with acne proneness, if you keep on applying a serum or a lotion, the skin will become more irritated. So it will rather, aggravate the condition. So you have to go in between, say gel cream kind of things. That will be ideal.
Right. We all know that sunscreens are so important for skincare point of view. And still in India, not many people are using sunscreen on a regular basis, but whoever is doing so, many a times they skip the moisturizer part because they are using sunscreen. As a dermatologist, doctor, what's your stand on that? Is it a good, okay to do practice if we are using a sunscreen rather than applying a moisturizer? Also keeping in mind these special, dryness related disorders.
Yes, if you keep in mind this dryness related disorder, the moisturizer is the foremost thing. This is the first thing to apply. First, you clean up your skin with a gentle cleanser. Then you apply a good quality moisturizer. And this moisturizer will protect your skin. It will keep your hydration balance. On top of that, you can use a good quality sunscreen. The sunscreens nowadays are also containing moisturizers, containing so many other ingredients, the pollution. pollutant, guard, and the
Hmm.
UV guard, the natural light guard, and anti-aging properties, so many things. But most of the important thing is before applying the sunscreen for dry skin specifically, and specifically in this winter season, you should
Hmm.
apply a good moisturizer liberally. Wait for at least a couple of minutes, then you apply the sunscreen, then it will work good on your skin.
Okay, fair enough. Now, as you said that it's important to choose the correct kind of moisturizer as per your skin type. Plus, in case you have any skin dryness related skin issues or any other skin issues, you have to be very particular about what you're using. Now, the market is flooded with products. Every cosmetic brand has so many things to offer. There are influencers on various social media platforms on the name of, individualistic approach or, customized product. They are also promoting or endorsing products. So we are falling for it. So why it is important to consult a doctor, a qualified dermat, in choosing the right kind of products, whether it's a cleanser, moisturizer, or a sunscreen lotion, doctor.
This is very important. Actually, this is the core of this discussion.
Right.
Because we know so many things now. It's thanks to these OTT platforms, the online things, the
Social
Insta,
media
and everything.
platforms, Insta, exactly.
Everybody has got some solution for our skin, and everybody is, into this skin business. But the thing is
Mm.
that we as dermatologists, we know the basic things, the skin types. It's not, you can just say, oh, okay, hi, this patient, this girl has got the dry skin, this kind of, okay, but what type of dry skin, what type of combination skin, what type of sensitive skin, or what type of actual skin you have, a dermat can better judge it, and accordingly they can plan, they can calculate the ingredients which should be most suitable for your skin type, and accordingly they will give it to you. Because if you think I have a dry skin and I should go for this kind of formulations, but eventually they land up in irritation, allergic reactions, so it will do more harm. So you are not going to help your skin, you are going to harm your skin. So it's always better to take guidance from a qualified dermatologist for better judgment, correct judgment of your skin type. Then you choose the correct product.
Right. We also these days are doing a lot of experimentation with our skin. For 2 months, we will use product A, then we'll use product B for another 2 months. Then there will be a new product in the market that is there. Plus, we are also falling, and it's an old tradition only. We are falling for moisturizers specifically, which are, more fragrant, which has, better smell or fragrance, we can say. Is it a good idea to go for something which has,
Not at all.
strong?
Not at all. I would not suggest at all about these things fragrancing, because you know what? Fragrance is a irritant.
Hmm.
Okay, because in dry skin, mostly there are sensitive kind of skin. Okay, and this fragrance thing, they causes more irritation and more allergic reaction, and you are eventually harming your skin. Okay, it will smell good. Your fragrance thing will smell good, but the thing is that you are not helping your skin by
Right.
using those kind of things. So better to go for fragrance free, hypoallergenic. Okay, those kind of things should be ideally chosen for your dry skin kind.
Okay.
Not
Thank.
only for dry skin, for every skin, because fragrance is something you put not directly over your skin. You put it
Hmm.
somewhere away from your skin so that it will not harm, it will not cause irritation for your skin.
And we also have this obsession for natural products. Though whatever we are using is not natural, nothing is natural. Even if we feel that haldi or turmeric is natural, there is a chemical name to it. If we think water is natural, there is a chemical name to it. So that way, considering nothing is natural. But then we have this obsession. And these days, again, market is flooded with products claiming that they are natural. Uh, what's again your take on that? Why should we not fall for them?
I do not think myself as a totally against of the natural products. Natural products are good. I cannot say natural things are not good. But the thing is that natural is how much natural. Okay. And first thing is whether it is suitable for your skin type or not.
Right.
Second thing is from where you have purchased and what kind of natural thing, whether it's a processed natural or it's a raw thing from your garden. Okay. And if it's a raw thing from your garden, then again you will have to choose according to your skin type, whether it's going to harm your skin or help your skin. Right. One thing, because natural foods, vegetables, and all those things, these are for eating, not for applying. Because applying, if you don't, if it is not suitable for your skin, you may end up in huge problem, huge trouble. Okay. Second thing is the processed in the Ayurvedic things, whatever is fully, flooded in the market. Those again, you don't know about the manufacturing, about the ingredients, about the vehicle, about his packaging, about everything. You don't know the correct, ingredients, their actions, their reactions, their side effects. You don't know anything. So you are blindly putting some things. You are taking some blind things. Okay, thinking it to be natural. So eventually it will harm your skin in the long run. It will damage your skin cells. So we have to be very, very careful.
Okay. Now there is one more question by Sumi. Her question is, do moisturizers help prevent skin flaking?
Skin?
Skin flaking, flakes that comes out of the...
Yes, again, in that case, you have to be very choosy regarding while choosing your moisturizer kind of. If your skin is very sweaty, then, the sweating, to prevent it or to control your, sweaty skin, you have to choose a gel base or a lightweight moisturizer so that it will help your skin. If you use a very heavy, very thick moisturizer, very thick layer, or the ingredients are not proper, it will lead to harm your skin. Otherwise, yes, in whatever skin type, there are some good quality moisturizers, perfect for, with perfect ingredients for each and every, skin type. So if you have to choose it, and if you know the things, and if you have a proper guidance, under guidance, you can use a good quality moisturizer to prevent sweating or flaking.
Okay. And Dr. Aruna, before we wind up, any take-home message, anything that you would like to add to whatever we have, chatted over moisturizer so far?
Okay. So it's a very good discussion. First thing is you should always use a moisturizer, uh, regardless of the weather. But the thing is that you have to choose it wisely, and you have to take guidance of a dermatologist properly while choosing your skin type and the moisturizer. And moisturizer, then sunscreen. These two are must thing for every individual, whether you are at home or whether you are going out, you are an outdoor person or indoor person, doesn't matter. So you have to choose your moisturizer, your cleanser, your sunscreen, serums very properly so that it will help your skin at any cost.
It was a wonderful conversation, Doctor. Thank you so very much for taking out your valuable time and making this session so informative. Thank you so very much, Dr. Aruna Devi, once again.
Thank you. I like it.
Thank you, Doctor. It was a pleasure. And we really look forward for many more such sessions with you in coming times. Thank you once again.
Thank you. Thank you so much.
So viewers, this was issued in public interest by makers of Lulibor Lotion Advanced Gen X, Division of Hetero Healthcare. Thank you viewers for your participation in today's session. Stay connected to our channel. Do not forget to subscribe our channel.